Your baby is getting closer to going home every day. It's exciting and at the same time a little stressful. The medical staff will work together with you to make a safe discharge plan for your baby. Although we do not have a specific weight requirement for discharge, they must meet certain criteria. Your baby must be more than 35 weeks gestation, be in an open crib, and maintain their body temperature. All feeding must be taken by breast or bottle without any NG supplements. They need consistent weight gain over a couple of days. They must also be free of apnea and bradycardias. Let's talk about common baby concerns and tips that will make the transition from home easier for you and your baby. First, we will talk about feeding. It is important that your baby feeds enough to gain weight consistently. They should eat every 2 to 4 hours. Feed the baby until sucking slows down and the baby doesn't want the nipple when offered. Never prop the bottle during feeding as it may cause choking. Your baby should be having 6 to 8 wet diapers a day. An occasional dry diaper is okay, but several in a row may indicate a problem. Formula-fed babies may only have a bowel movement every 1 to 3 days, where breastfed babies have more frequent bowel movements, which are yellow and soft in appearance. Breast milk and formula contain enough water, therefore it is not necessary to give the baby additional water. Discuss with your nurse how much your baby is feeding at discharge. This feeding amount will gradually increase over time. For breastfed babies, a breastfeeding session should last approximately 20 to 30 minutes with a good latch and consistent sucking and swallowing. Your growing preemie may require supplemental feedings with fortified breast milk or formula as recommended for extra calories and adequate weight gain. Discuss with your pediatrician how long these supplements are necessary. Ask about additional resources available to support successful breastfeeding. For formula-fed babies, the American Academy of Pediatrics recommends that your baby stay on formula for at least the first year of life. Talk with your baby's follow-up caregiver for their point of view, and together you can discuss what is best for your baby. There are many different formulas on the market. They may be available in the following options: ready to feed, liquid concentrate, or as a powder. Please carefully follow the manufacturer's instruction for mixing. Be sure to mix or shake the powder formula well, because your baby's calories and nutritional content are in the powder. Be sure to understand your baby's feeding requirements. If you have well water, you need to boil the water and allow it to cool prior to mixing it with formula, or you may wish to purchase bottled water for formula preparation. When you are warming cold formula, it is best to bring it to room temperature by using a pan of hot tap water, and remember never to warm formula in a microwave. This may heat the formula unevenly, causing mouth or throat burns. If the baby does drink part of the bottle, throw away the leftover formula and never refeed it at a later feeding. To clean bottles and nipples, use hot soapy water. It is not necessary to sterilize nipples and bottles. Babies have a natural need to suck, and pacifiers can offer them comfort and satisfaction, but should not be used to substitute a feeding. Be sure to periodically check the condition of the pacifier to make sure it is safe. To do this, you can tug on the end of the pacifier and make sure it is not loose or the rubber is not weak. If it is, you need to throw it away. Also, never tie the pacifier around the baby's neck, as this may cause strangulation. After the baby is fed and ready for sleep, it is important to use proper positioning for your baby. To decrease the risk of sudden infant death syndrome, also known as SIDS, position your baby flat on their back on a firm mattress. Your baby should sleep in a safety-approved crib or bassinet, separate from where you or others sleep. Do not let your baby overheat during sleep. Other ways you can decrease the risk of SIDS include a smoke-free environment, keeping the crib free of pillows and toys, no loose clothing or blankets. When your baby is awake and in direct contact, tummy time is important to help prevent early motor delays and strengthen head, neck, and shoulder muscles. Just a few minutes, a few times a day is beneficial for your baby. time is a very important time for you and your baby. Prior to discharge, try to arrange time with your nurse to give your baby a bath. At home, be sure to choose a warm room to bathe your baby that is free from drafts. Gather all your bath supplies before starting the bath. You will need a tub or a sink, mild soap, a towel, washcloth, clothes, and a dry diaper. Test the bath water with your elbow or wrist to make sure it is comfortably warm. It is very important for you to never take your hands off the baby or leave the baby unattended during the bath, not even for a second. It only takes a second for the baby to slip into the water. It is not necessary to use lotions, powders, or oils on your baby's skin. They have natural moisturizers, and the use of these products may cause a skin rash. Your baby's skin is still very sensitive, and a diaper rash can easily develop. It's okay to use over-the-counter diaper creams, but contact your care provider for any diaper rash that persists or worsens. Diaper care with a baby girl includes wiping from front to back. Wash with soap and water after a bowel movement, rinse and pat dry. When caring for a baby boy who is uncircumcised, wash, rinse, and pat dry as needed. There is no need to pull back the foreskin. That is the skin at the tip of the penis. Forcing the foreskin back may cause bleeding, pain, injury, or scar the tissue. For a baby boy that is circumcised, the site may look red for about a week after the procedure. After the baby goes home, you will want to notify the baby's follow-up care provider if the circumcision starts to bleed, has a yellow-green discharge, a foul odor, or the baby is not peeing. Clean the circumcision at each diaper change by squeezing warm water over the tip of the penis. You will want to apply A&D ointment for a few days after the procedure. This prevents the diaper from sticking to the circumcision at the next diaper change. Sponge bathe the baby until the circumcision is pink and well healed. This takes about a week. Wash gently with soap and water after bowel movements as needed. Once you take your baby home, there may be many visitors who want to meet your baby. Be sure the visitors are free of illness. It's very important that anyone caring for or touching your baby wash their hands with warm water and antibacterial soap. This will help prevent the spread of germs and keep your baby healthy. We can't stress enough how important it is to maintain a smoke-free environment. This includes smoke in the house, in the car, or even the smell of cigarette smoke on clothing. The effects of smoking are detrimental to your baby's health. Smoking can cause ear infections, asthma, respiratory infections, and other illnesses. It's important to limit your baby's exposure to public places, and except for weather extremes, it's okay to take your baby outside. Dress them in the same type of clothing that you would be dressed as. Do not take the baby into direct sunlight. Use hats for protection from the sun, wind, and cold. The medical staff in the NICU does not continue to take care of your baby after discharge. You will need to have a follow-up care provider. You may choose a pediatrician, a family practice doctor, or a nurse practitioner. Please tell us who you have chosen so that we can send them a summary of your baby's hospital stay. You will have an appointment with your follow-up care provider within the first few days following discharge. Further appointments will be scheduled according to your baby's needs. You may also need to see specialists after your baby goes home, including an eye or heart doctor or a neurologist. These appointments are very important for your baby's well-being. It is always advisable that your baby receive well baby checkups and to keep immunizations on schedule. Many parents are unsure when to call the doctor. If your baby acts sick, you may take their temperature. Fever is a sign of illness. Sometimes a small baby's temperature will drop instead of increase when they're sick. The NICU recommends that you take the temperature under the armpit. The normal axillary temperature is between 97.6 and 98.6. If you are taking your baby's temperature and are concerned about their behavior, you should call your baby's doctor. Some other signs of illness may include poor feeding, vomiting, frequent watery stools, an inability to calm or unusual irritability, difficulty waking your baby, a cough, or trouble breathing. And be sure you know how to use a bulb syringe to clear your baby's airway of secretions. Babies born prematurely or sick are at increased risk for RSV. This virus can cause an upper respiratory infection. With RSV, adults, older children, and infants have typical cold symptoms. However, babies who are born prematurely or have ongoing lung problems are at higher risk for developing severe respiratory problems. If they catch this type of cold, there is now an immunization, Synergis, that is given once a month during the cold and flu season. Synergis does not prevent a baby from getting RSV, but will lessen the severity of the illness. In this area, RSV season can run from October until May. Some babies born under 35 weeks meet the criteria for Synergis, but determination is made on a case-by-case basis. Check with your baby's doctor to see if your baby needs this shot. If your baby is discharged home during the flu season, you will want to discuss this on the very first visit. Many infants may receive medications like vitamins and iron while they are here in the NICU, and these may continue at home. Your follow-up provider will decide how long your baby will need to continue these. You need to understand all medications prescribed for your infant and make sure you know what the medication is, why it is being used, the correct dose, how to mix it, the side effects of the medication, and when to stop the medication. State laws require that infants ride in approved car safety seats. It is your responsibility to know your seat and proper installation for your car. Please read your car owner's manual and the car seat instruction booklet. If your baby was born prior to 38 weeks, they will need a car seat evaluation. You will secure the baby in the car seat for this test. Some features to look for when purchasing a car seat include infant only and rear facing, approved for 5 to 20 pounds, a 5-point harness, multiple shoulder slots, and 2 crotch slots. Used car seats need to be less than 6 years old. Making sure your home is childproof is just as important in preventing accidents. You can learn a great deal about the home by getting a baby's eye view. Get down on the floor and inspect the environment as your baby sees it. You may be amazed at what interesting but dangerous things are available to your baby. There are many home safety suggestion tips in the Going Home with Your Baby book. Never leave the baby alone on a raised, flat surface. Never leave your baby alone with young children or pets. Never leave your baby unattended in a parked car. Always use safety strap on infant seats, high chairs, strollers, and infant carriers. Plug or cover all unused electrical outlets. Never let your baby chew on electrical cords. Put safety catches on cabinet doors. Keep all medicine, cosmetics, and cleaning supplies out of baby's reach. Never place your baby's crib anywhere near dangling cords or mini blinds. Never pour hot liquids while holding the baby or when the baby is close by. Our goal is for infants to go home free of equipment, but some infants will require special home equipment, including oxygen or a breathing monitor. If this applies to you, know that we will be arranging for Home Care Company to come into the hospital to teach you to know how to use the equipment. We recommend that you spend time in the parent room caring for your baby independently, as this will give you a chance to use the equipment and become comfortable with its use before you go home. Your caregiver will evaluate your baby's ongoing developmental milestones. Some infants may be at higher risk for developmental delays and may benefit from services or other agencies, such as CIDS, public health, or early intervention. These services help you and your baby meet their developmental milestones. Just remember, we are here to help you care for your baby. We are always happy to answer your questions, and now is the time to ask questions about any remaining concerns you have. So when you get your baby home, you can relax and enjoy having the baby all to yourself. Don't forget, we love to see photos of your little graduates from time to time. So keep in touch and let us know how all of you are doing. Good luck and congratulations.